and welcome back to Whitecoat Medicine once again. This is Dr. David Cruz, and today we're going to start a talks on hypertensive medications. We're going to start with ACE inhibitors, angiotensin converting enzyme inhibitor. Now, this class of medication was made back in the 1970s, and you'll recognize these medications because their generic names all end in PRIL. Here is a list of these medications, and if you want, you can pause the video at this time and make sure that this is one of the medications that you are taking. Now, to go on and explain how these medications work is very important. Knowing the mechanism of action of how your medications work is very important, because as you start getting different medications, you'll understand why your doctor is giving you different medicines and how they're working and what you shouldn't be taking together with other medicines as well. So the main thing that it does, it will dilate your blood vessels. Now, dilating your blood vessels will allow your blood pressure to come down, and that's the way these medications work, simply put. But I want to go into a little bit further detail just so that you understand where this all comes from and how they actually do work. So it all starts in your liver, and your liver produces a protein called angiotensinogen. Now, in two steps, it's broken down to angiotensin 2. Angiotensin 2 will then increase your blood pressure. What happens is angiotensinogen is broken down by renin, which is changed over to angiotensin 1. Angiotensin 1 then goes to angiotensin 2. Now, this is where our medication that you're taking right now works. It stops angiotensin 1 from going to angiotensin 2. The enzyme that produces this change is angiotensin converting enzyme, and thus now we have the inhibitor, which then stops that change. Now, by stopping angiotensin 2 from being made, we're going to do two things. We stop the production of vasopressin, and we stop the constriction of blood vessels that angiotensin 2 does. As with any medications, you can have side effects. The main ones that your doctor will be looking for is, first of all, if you have swelling to your lips or your mouth or anything like that, then go on ahead and tell your doctor right away about that and stop taking the medication. This will not be a medication that you will be continuing. Next of all is your medication can cause hyperkalemia, which means your body will be storing more potassium in its body. Therefore, don't take any potassium supplements unless they were advised by your physician. One of the main reasons I take my patients off the medication is because they develop a dry cough. If this becomes very persistent and bothering and you can't sleep with it, then we switch you off the medication, put you on a different medicine, which we will discuss later, and the cough should slowly resolve, hopefully over the next month. In addition, there can be other things such as dizziness or fatigue or headache. When your blood pressure is coming down, you may feel those symptoms as well. Now, if your blood pressure for some reason does not come down, or it actually spikes up, then advise your doctor right away, because they will be doing some labs and possibly some other studies to make sure there is nothing else going on in your body. Overall, these medications have great benefits for your body. They do protect your heart and they protect your kidneys, and it is very important and vital that you follow the recommendations of your doctor to take these medications. This is Dr. David Cruz with Whitecoat Medicine. Thanks again for listening in, and we'll see you next time.